But what is the what's the danger here? If we block too much calcium, you might stop the heart from beating. So you got to really be careful with that dosage. Again, the heart muscle needs calcium to contract. So if you completely remove calcium from binding to the heart, then you might slow the heart rate down too much. So there's your C, and then diuretics. Pretty straightforward. How do diuretics treat blood pressure? Right. Remember, we've got most of blood is just water. If we remove, most of blood is just water here, right? If we remove the water, decrease the water content, we're just getting rid of the fluid that's in the blood vessels. So we're decreasing the blood pressure like that. And that's also a pretty good alternative if you don't want to mess with your heart. Personally, I wouldn't want to take a drug that worked on my heart because I want my heart to function normally. If I could find another way to get my blood pressure down, then that'd be great. And what it really is about hypertension that's bad is that if you've constantly got a lot of blood pressure in your vessels, a high pressure, it starts to destroy or damage those vessels. And also starts to put stress, a lot of stress on the heart. Over time, your heart doesn't like that, and it starts to shut down. It's a major cause of congestive heart failure. Last slide here, we talked about this already, but let's revisit it. But the venous return is described as return of blood to the heart. Venous return is necessary for a good stroke volume, right? If you've got more venous return, if you've got more blood going, let's just draw a simple heart here. If you've got more venous return, increased amount of blood, then you are eventually, when the blood gets to the left side of the heart, you're going to have a better stroke volume, right? The more blood that gets in the heart, the more blood your heart can pump. It's a perfect correlation. So increased venous return equals an increased stroke volume. That's necessary for a good cardiac output. If you don't have good venous return, you will not have a strongly pumping heart. So you won't get a good cardiac output if you can't get a good amount of blood back into that right atrium. So what we have to do is we have to somehow find a way to get that blood back, and especially from the veins in the legs, right? It starts to pool down there. So you guys are feeling probably a little bit under the weather right now. You're in anatomy class on Friday, and you're sitting down. Sometimes I would literally stand up in class in the back of the room if I start, because I would fall asleep in my hand is here. I would fall asleep in my classes, and my favorite classes. I would love these classes, but I'd fall asleep. So one of my physiology instructor was like, Dan, if you just get up and you do leg lifts, or if you do calf raises, then you won't fall asleep. So he just let me go to the back of the room and do some calf raises, and students looked at me funny, and then I came back and sat down. So if you're on a plane, and by doing those calf raises, what you're doing is you're contracting your muscles, and you're pumping blood up through those veins. You're actually, I never thought about it like this, but you're creating little hearts in your legs, right, to beat the blood back up to your actual heart. And remember, as blood goes upwards, it's prevented from going back down by what?
Valves.
Those valves that you have there. Good. So venous return in the heart depends on 5 mechanisms. The strongly beating heart, we talked about that. If your heart's not beating strong, that blood's never going to get to the end of the vein. An adequate blood pressure, which is caused by a strongly beating heart, those two go hand in hand. Those valves in the legs, and the pumping action of the muscles. That's what I was just talking about. If you start to feel tired, all you got to do is, even right there in your seat, if you just do this, and you just contract your muscles a little bit, you're technically getting more blood to your brain because you're sending it back to your heart to be pumped up there. So that's why, you guys ever heard of a DVT? What is that?
Deep vein thrombosis.
Deep vein thrombosis. When do people get those? When you stick around on your couch all day, right? You're not moving, you're not pumping your blood, you're not moving much. And also, international flights are another cause of DVTs. So why would being on a flight for 12 hours cause a DVT?
Because I'm not able to stretch or get up, like get up and down on the flight.
Yeah.
You know.
If you don't move your legs,
Mhm.
then you're not pumping the blood back up to your heart, and the blood just pools down there in your valves. So these are legs that aren't moving. The blood never gets sent upwards to that X valve. It stays there, starts to coagulate and forms a clot. What happens when you stand up?
It's going to travel up
Breaks loose, goes up into
your lungs.
Yeah, and why does it get to your lungs? Why does it specifically go to your lungs? Think about blood flow through the heart. Your physiology will help you with this. So this is the vena cava, right, that was coming from your legs. Blood gets here, into the right atrium, down to the left ventricle, right ventricle, and then where?
Back up to the pulmonary.
Right into the pulmonary circuit, right? And remember, the pulmonary circuit gets thinner and thinner until we reach capillaries. So that blood clot's never going to get through pulmonary circuit. It's going to clog up the capillary and cause technically suffocation because you can't get. If you clog up a huge artery in your lungs, no oxygen's gonna. Blood's not going to move, so no oxygenation's going to happen.
Respiratory failure.
Yeah, and that's causing, suffocation is respiratory failure. So, always do those calf raises. Yeah, go ahead.
After surgery is big.
After surgery, yeah, as well. Why is that?
Because they're not moving.
Right.
But now they put the
air
compression boots on.
Sure, that's a great idea.
Keeps it
And
pumping.
last thing, if you want, if you're on your feet all day, working, or even if you just sit at a desk all day, you want to wear compression stuff. If you're not moving your legs around very much, or if you are experiencing edema, you want to wear the compression stuff, right? To get, I don't know what they're called, I'm just going to say compression stuff. What are they called?
They're called TEDHOs.
Okay.
For anti-embolism.
Yeah, because you keep your legs contracted, which means you keep those the blood running up back towards your heart and increasing the pressure here to push it up. And that's also going to help you avoid varicose veins, because what varicose veins are just blood pooling down in the vein, and then it starts to expand that vein. So if you can push back on that vein and send it up, you avoid varicose veins. Okay. Any questions? Guys, make sure you know your 9 major pulse points. They're all right here. You guys have done these before, right? Temporal pulse, let's do that one real quick. Temporal pulse, right? What you do is you find the ear, you go just about an inch forward, kind of wiggle it around, and that's one of the most superficial arteries in your body right there. And then the next one is facial. Get right there in the angle of the mandible and kind of wiggle your finger around until you find that tube. And you can actually feel that one pretty easy because there's just one artery that travels across your mandible. So you just kind of wiggle around right there in the center of your mandible, and it's right there. That's facial. We all know where carotid is, right? Between the trachea and the jugular. Brachial, that's the one in between the triceps and the biceps, and that's the one that you measure blood pressure at. Radial is the easier one in the hand. You get on the thumb side, and you can feel it there. Ulnar is a little bit more difficult. You have to push down pretty far to get to ulnar. It's just on the other side in the same spot. But that's not one of your major ones there, ulnar. Femoral is where your external iliac artery exits your inguinal canal. This is your inguinal canal here, your inguinal ligament. So you can find femoral there. Popliteal is really tough to find, and it kind of hurts. You got to get all the way behind your knee and press really hard. I don't like finding that one, but you might have to.
I've done a blood pressure in the leg before.
Wow, in the down here or right here?
In the thigh.
Oh, femoral.
Using popliteal.
Oh, using popliteal. Wow, cool. How'd that go? Did it work?
Actually, it worked really well, so the one day she finally went into respiratory failure.
Oh, okay.
But that was, the order was to do it there.
Okay. Why? Didn't.
I don't remember, it was, I mean, we're talking back in the early, no, actually late 80s that I did it that way with her.
Maybe they
With
thought.
Resident.
Maybe they thought that if you started to block the brachial artery, it would keep blood from exiting the heart.
So I don't remember what it was, but that's where we always took it, because of the order. And then
Okay.
one day she went and
She was gone.
911, she was out of there.
Yeah, I can
couldn't
only.
find it.
The only thing it's gone after that.
It was gone.
The only thing I can think of is that it's just if you block that artery, it keeps blood from leaving the heart, and they probably want blood to pump
Yeah.
through her body.
It's been so long, I just don't remember what her, I remember bits and pieces of them through the years.
That's cool. It gives you experience for an addict. Posterior tibial and the dorsalis pedis artery. What does that word ped mean? What does that stand for?
Like cattle, like we're
Think pediatrics. What's that?
kids.
Kids, right? Oh wait, no, that's wrong. Ped, foot.
Yeah.
I went for the other one.
Yeah.
Ped, foot, right? Yes. Come on. It's Friday night. Ped is referring to foot, so you can feel that pulse. I'm not gonna make you guys take your shoes off, but if you get right in between your big toe and your second toe down there towards the bottom, you can feel where that artery kind of pops out there. So practice that one at home if you can get that one. One of the other nurses in my class says that he puts his whole hand, or both his two fingers across the entire foot to feel for it first, and then he knows where to go. All right, that's it, guys. Any questions on the stuff? As I said, just to summarize, we did heart, right? We did blood flow through the heart, and then we talked about the different circulations. We talked about pulmonary versus systemic, and then we talked about the one to the digestive system. What was that?
A hepatic.
Hepatic portal system, and then we talked about fetal circulation and those structures, the unique structures. Make sure you know that. And then we talked about things that affect blood pressure, because all these things will come into play, and especially when you're studying drugs as well as your med surg class. Any questions before we?
What diet, so it's the heart diagram we need to know?
Yeah, make sure you know the diagram on page
78, I think it is.
278. Make sure you guys know the chambers of the heart as well as the electrical conduction of the heart. And on that picture are all the conductive structures of the heart. Okay. All right. Any questions? Good to go. Okay. So I'll get you that homework. And everybody have a good night. Make sure you sign the attendance sheet.
And when you say you said know the picture and the one